Bob Silent method is without patient interaction and view. The patient can relax and Bob is for my view only at this point. As Edward is a new patient today, I begin Bob by completing an intraoral examination. I input into Bob any missing teeth, crowns and/or implants. This information is saved, and on future Bob sessions it will only be necessary to input any changes. I then start a new Bob score. I will complete this Bob assessment using the IAP full method, which will take me approximately 2 to 3 minutes to complete. I begin by using the prime IAP in Edward's upper right sextant, as this is where the Bob score begins. I then input the correct colours indicated from the IAP into each interdental space on the chart. I then continue to the next sextant, that being the upper anterior teeth. As you can see here, the probe is very simple, quick and effortless to use. As I continue to the upper left sextant, I notice that an interdental space is too large for the colours indicated on this IAP. So I change to the perio IAP to measure the interdental space. I then return back to Bob and input the correct colours from this sextant. When using the IAP on the lower anterior sextant, it clearly indicates the colour turquoise on the probe for each interdental space here. I input this information into Bob by holding down the turquoise button, which then infills each interdental space with turquoise. I complete my IAP full assessment on Edward's lower right sextant. I then return to the upper right sextant, where I can now begin the bleeding on interdental brushing index by using the interdental brushes. I can now view what interdental aids I need to use, as the colours match with those of the IAP. I now begin with the pink prime interdental brush. I also use a single tufted brush in this sextant, as Edward has a large interdental space here. I input this brush into the Bob score by clicking the Others button, which appears then as a grey circle on the chart. I continue onto the upper anterior sextant and check the colours from the IAP are a correct match with that of the brush. I also input where there is bleeding present. Moving on to the upper left sextant, I check and measure inflammation with the Prime Green Red Perio 405 brush and Prime Pink brush. I decide that the pink I input from the IAP here will not be so accessible and easy with the interdental brush for the patient, so I change it to a prime turquoise on this occasion. Moving on to the lower left sextant, I continue with the interdental brushes and inputting any bleeding present. When using the turquoise on the lower anterior teeth, I feel that there is one area in which it is now possible to increase the size brush to that of the pink prime. So I change the colour brush here to the pink prime. I finish on the last sextant, that being the lower right, and it is now time to continue with the dental cleaning. It is now time to complete the patient's dental treatment. In my case here, I will complete my treatment with the dental hygiene cleaning, as the patient is already in the correct supine position. After his dental cleaning, I will then complete his review and coach. The review and coach begins by bringing up my patient's full mouth map, which I am then able to review. As it is my patient's first visit today, I return to the score to minimise the quantity of aids in his chart. I decide to change the green and red Perio 405 to the pink prime, which is the next largest size already in his score. I then bring up the full mouth map again, and by clicking the button on the lower left corner of the screen, I can place the mouth map into the patient view. I then share this view with the patient, who now has a mirror image of his mouth and an assisting mirror in front of him. He too can have an overall review of the interdental aids recommended and also what areas have shown signs of inflammation. I explained to Edward that we have 3 dental aids that will need to be used daily. I begin the dental coaching with my patient by suggesting we begin with the smallest interdental brush and in an area that will feel easy for the patient when starting. In Edward's case, I have suggested the turquoise prime interdental brush to be used on the upper anterior teeth. The reason why this routine is suggested is to help build upon the feeling of ease and success when using the interdental brush. This also gives the patient confidence when it comes to using the interdental brush later on at home. I continue assisting and teaching Edward the technique by using touch to teach methods. Edward is always using the mirror to view his technique. Edward also requires the single tufted brush in the upper right sextant. He has a large interdental space here, so I demonstrate the use of a single tufted brush. This is shown as a grey circle on the mouth map. Once Edward is feeling confident and competent with the smallest brush and the single tufted brush, we then move on to the next size up, which in his case is the prime pink brush. I continue to assist Edward when completing the coaching, using touch to teach methods to ensure he is learning an atraumatic yet effective technique when using the aids. I then move on to another sextant we have not used a brush with yet. Here I demonstrate the turquoise prime again and assist with his technique, as it will be slightly different compared to using it on the upper anterior teeth. I then ask Edward to pick up the pink prime brush and ask him to show me how he would use it on the lower left sextant. He is doing a great job so far, yet I still assist him with the technique needed here. I now discuss with the patient the quantity of dental aids I have recommended and ask for his feedback in how he feels about using this quantity daily. I remove Edward's mouth map and ask him to now click the finish button so that he takes ownership of his own health. Once the finish button has been clicked, the Bob score is completed and Edward receives his overall Bob score, which I discuss and explain further. Edward now understands the importance of cleaning interdentally daily and feels motivated and supported to do so. I then show Edward where we would view his past and present Bob scores. His full mouth map is also viewable to take a final review and remind him that this is the image he can use at home to support him in using his interdental aids. The interdental brushes recommended for him at this time, and I then make a note in the comments section to give him a reminder when he gets home. The comment I decide to make is that the grey circle on his mouth map indicates the use of a single tufted brush in that region. I then save, close this Bob session and send the patient his Bob score, which he will receive via email. That now completes the Bob Silent method.